talking about, this is even more ambitious. Folks in the communities we're working in cannot afford to go to Gold's Gym or Perth or even the YMCA. Can't afford to pay the membership. They want to be active. What happened if we had our physicians prescribe physical activity, and then right next door or in the neighborhood there's a place they can go that has a check? And how can we do that? Can we get Medicaid or insurance companies to reimburse the folks at that check? We're working on it. That's a kind of a federal thing because Medicaid is administered by the Centers for Medicare and Medicaid Services, but it's also local. And what we're doing now is finding some examples of how it might work. So we use that in our advocacy efforts. So things are moving, but I mentioned advocacy. And without communities, we aren't going to make anything happen, for sure. Why is community engagement essential? Well, we've already talked about the fact that collaborative is a source of policy ideas. When we had our focus groups with folks from ages 7 to 80, they had great policy ideas. The community is a source of ideas. And if you want to know what works and what people want to work, ask them. The biggest complaint we heard when we first came into the Ward 8 community was people are always coming in and doing research on us. And then they leave and they never ask us, first of all, they never tell us why they're there. They never give us any feedback about what they learned, and we never hear from them. And does that create a little cynicism? I suspect it does more. There's been research to that. But what about answers that they come up with, and then seeing those answers implemented? So that's why our approach has always been not only finding out what people want, but then helping them do it. And we do know that community engagement leads to individual and community empowerment. We have a team of 10 peer educators. Many of the ladies are overweight and some are obese. We've asked them to spread the word about the importance of healthy eating and active living. One lady said, you know what, I really can't get up in front of my neighbors and talk about this, and I don't do something about my own health. So she has become known as the food police in her household. She's also come off of her blood pressure medicine because she changed her diet. Another peer educator said the same thing and began to, in addition to her educating role, has started walking. So she says, I've got to do this. I can't just get up there and talk and people say, well, you're not doing that. I have to do something myself. That is how people get engaged to make behavior change. Behavior change is hard. How many of us have tried to stop doing something we shouldn't do and change our behavior? It's not easy. But if folks feel, I can do this, because we can do this, it's a lot easier for them to do this. And of course, if our community is involved in creating the policies, proposing the policies, the likelihood that they want to adopt the policies and advocate for the policies is greater. In our third year now, we're in our third year, our focus is on advocacy training. And we are working with communities in that category. So this is the way we set our priorities. I talked about the collaborative. I didn't mention surveys, but one of the ways we got a great response in getting surveys filled out is to offer a free leave system. Not everybody got one, of course. This is a drawing. Got 1,200 surveys completed. We had youngsters sitting in the middle of the floor we had a huge convention center, a big health fair sponsored by a local TV station. Thousands of people passed through. We had more people at our booth than anybody else. Why? Free leave system. And we actually awarded it and got the word out. So the next time we had a survey, we had even more. But that surveys are great ways of finding out what folks really want. And so are focus groups, as I mentioned. And we've had interviews with key stakeholders and town hall meetings and another strategy to get input. And most importantly, we have to report back. This is the report that we circulated. We ultimately had 275 people that we engaged with in an intense kind of way either through focus groups or detailed surveys. And so every one of those persons received this stuff. It says, we heard you. And we gave them feedback on the 4 policies that we asked them to assess. And you can see that the feedback on the policy for after school had strong support, but so did the one about increasing healthy food outlets. We had great support for the park keepers, park stewards, workforce idea, pretty good on the other one too, which is why we are working them all for, especially since we've made some good progress on the first 2. So now, when we go back to the community, we're saying, not only did we hear you, but this is what's happening, and it's working. And I talked about our partners. Now, we believe in paying our partners. Not everybody does. But we really believe in sharing as well. Now, it's not a lot. Our partners receive anywhere from $2,500 to $10,000 from our $100,000 a year stipend. I say stipend, from Robert Johnson. And we're required to match it by 50%. Maybe that's what it is.
Click
Advance again.
and then click again.
There we go.
And
It's
it'll all
coming. It's
show up.
coming. It's coming.
It's automated. There you go.
Yay. Okay, so now you see what these various partners are responsible for. And they are not just coming to meetings. They have work that we've asked them all to do. Mostly work related to one of those 4 policies. Okay. So, each partner has a scope of work, and in their scope of work, they're accountable for producing certain deliverables and/or tasks. And so that's how we not only make sure we have the right partners at the table, but we get our partners to share some of the work. All right. So, good. Okay. Any project has to worry about sustainability because, unfortunately, funding doesn't last forever, right? But so you think about, well, how can we make this live on beyond this? In one regard, we're trying to get match funding. We have to actually. Robert Wood Johnson asked us to come up with 50 cents on every dollar we give. That's ambitious, and we're doing reasonably well because we have people who think that we're doing this worthwhile. But another way to really assure sustainability is through policies. Now, once you get a policy enacted, that goes on no matter what happens to you. And so, moving at the policy level, getting something written into law, written into regulation, is certainly a way to sustain an effort. And I think the most significant way of sustaining anything is to engage a community of advocates who keep on pressing for anything they feel they need, whether it's something that came up through your process or something that they feel after your own. So there are all kinds of strategies for sustainability, and that's why we talk about a three-tiered support. These are some of our funders today: Kaiser Permanente, United Way, MARPAC. We're working for others and with others and on others. Now, some recent developments, and I've got to share this because when people have an experience of success, it really builds their confidence in their ability to do something for themselves and with others. Everybody know what a community playground is like? Well, we got a chance to work in a people's co-op, which wanted a playground in their complex. They owned the complex, but they had a spare space and their children were playing in the parking lot. So we need a playground. So we went to Kaboom, got craft food. They got craft foods involved. We got involved. And in one day, October 6, 2010, we had 275 volunteers. We built the thing in one day. I didn't believe it could happen. It did. And there it is. And the people with blue shirts, all of us had blue shirts that day. These are residents of the community who did the hammering and the nailing and the putting them together and what have you. And the children, if you could have seen some of the little ones carrying the mulch back and forth like little robots, they got it done. And now the point is, we can do this. Very important activity. What does it have our partnership? Well, nothing directly, but everything. Building support, building moving, building a sense that we together we can. Then another thing we got a chance to do, because you always do that politics stuff. Robert Wood Johnson said, would you help us host the congressional visit to Ward 7 and 8? Because the current congressional staff don't know anything about this. They don't know what we're talking about. They don't understand the importance of the environment. And so he said, great, we'll do this. We did that and got very good reviews from them. And we had some bus stops. And one of them was, as you can see, at Marvin Day Community Park, where we introduced them to instant recess. And depending on our time, we might be able to do a demonstration of instant recess here. Why instant recess? Well, because let's stop talking about those people and those folks. Let's talk about what do we commit ourselves to do this day. And this is a program where you can 10 minutes a day, you can simply stop what you're doing, do an instant recess together, and feel great after it. It certainly beats a coffee. So if we have time, we can give you a demonstration of that. But I say that to say, we have to walk our talk, and we can't just talk about these things and not really practice open culture. That's one of our ways of doing so. That is our presentation. I'd be delighted to hear your questions, your comments, anything you want to know more about, anything you'd like to challenge me on, that's fine too. I used to teach. You know that. But at any rate, thank you for your attention. It's been fun.
Any questions for our speaker? Yeah, Matt has a question.
Well,
Yeah.
I can defer to instant recess.
Okay.
All right. Thank you for coming. I have a great question. I have a question about your great work, pulling in all these different agencies from the city level. And I was wondering your approach to getting them on board. Did you approach them directly? Did you know people in those departments? Or did you request the assistance of a higher up in city government that top down said you guys gotta get involved in this?
Well, we were looking for moles. We were looking for people who we knew were working quietly on things that we were all concerned about, but with or without the support of the supervisors. Now, in the past, in the administration that just left, it was mostly without support of the supervisors. They were mid-level folks, bureau chiefs and multiple public assistants. They had a job that allowed them to do some of this, but they did not seek the blessing of the higher ups because they wanted to say that. So we worked quietly. They came whenever they could. Let me make a good example. The Department of Health was putting together an obesity action plan. We had 2 people from the Department of Health on our partnership. They took some of our policy options and pushed hard to get them into the action plan. They never said where they came from. They never said, we've been asked to do this. They just did that. And because they could work quietly and old-fashioned, we actually got it in the action. We got the Medicaid reimbursement one in there, and we got the after-school program. So sometimes you don't always get the higher up approval, and sometimes you don't even want it. You don't want to say no. You work with the people you know. The people who are bold enough to say, I'm gonna come to the table and I'll just take it and half it off. And at some point, when the leadership changes, and in our situation it has, then they have the blessings of the higher ups. But in the meantime, we've had the benefit of